Hey everyone, it's me again, just coming back to you with some more videos and sort of talking about some things that we feel could be priorities for you guys and would help out from a long-term standpoint with your horse. So rehabilitation, you see tons of it out there now, and it's kind of a catchphrase, especially on the equine side. Everyone's talking about how they rehab their horse, where they're coming back from, where they're going, soft tissue injuries, joint injuries, back injuries. You know, like just the other day I just watched, there's this whole new field of rehabbing backs in horses, right? We've been doing that for a long time, but with the dorsal spinous process overriding, so kissing spine, you see lots of talk on that. Definitely suspensories, deep digital flexors, muscle tears and stuff like that. It's pretty common for us to talk about. I do think also older athletes that are coming back from some time off, or any athlete that's coming from time off, you could approach that from a rehab standpoint. Things that are critical for us, and it's a resounding theme, so if you've listened to any of my videos before, we talk about, first of all, you need to make sure that we have pain relief. Okay, so if we're doing rehab, that's a big part of it, is where are we at with our pain and how are we going to manage that from a veterinary standpoint. Then we're going to want to increase that range of motion, right? Once we have that good range of motion through those joints, ligaments, and tendons, then we're going to start trying to build some strength. And I think that's where a lot of rehab programs break down, because we get so used to conditioning, right? Conditioning and rehab are similar, but they're not the same, right? So I want to go through a little bit of the breakdown. Thinking about conditioning is when I'm already pretty fit and my body is pretty healthy, okay? And that means not just healthy like not broken, but it means healthy like it's used to that exercise, okay? So let's just use an example. Let's just say that I'm a 7-year-old jumping horse that's jumped since I was 4, and I really know how to jump like 1.20 meters, 1.30 meters, or I've been even higher, let's say, okay, just as an example. I can jump at that level, okay, and I'm qualified to do that. My body will do it. But am I conditioned, or am I ready to do it? Okay, if I've been off for 3 months and you take me out and jam on me in the 3-week period, I can do it, but my body's not ready for it. Okay, so I want you guys to kind of keep that in the back of your mind, that think for yourself. Okay, let's come back to a barrel horse. Okay, just because I can run a 17-second pattern, if I've been off for 3 weeks or I've been off for 4 weeks, am I really ready to run a 17-second pattern or 16-9 or whatever it is on a big pattern? I can do it, but my body's not ready. So I want you guys to kind of come back to that a little bit. Just think about the basic physiology, right? We're going to need somewhere between 8 and 16 weeks to condition that tissue, right? And if we think tissue, meaning bone, ligament, and muscle, and did I have tendon? Oh, tendon. I won't forget that one. That is an important one. Tendons. Okay, so we want to have those tissues ready to recoup, right? So that means I tear them down a little bit, or I stress them a little bit, and then I let the body recover. Okay, I think that's the thing that I'm trying to get at, is if we tear the body down, but it's not ready to recover because it's not going through that cycle, I think you see your horses deteriorate sooner throughout their life, right? And so the rehab for us is essentially that. How much of a scale, right? Am I going to go along like this and then slowly go up? Am I going to go like this, or am I going to go up like this? Okay, well, I mean, if you think about it on a gradient sort of thing, this is probably going to be better for us in the long term from a tissue standpoint, where we won't develop such a chronic reduced range of motion through hocks and stifles, sacroiliac, backs, all those kinds of things. That horse is going to have to store that inflammation somewhere if we don't take it out through our rehabilitation, right? So keeping in mind that rehabs tend to start a little slower, and then once we feel like that tissue is solid, then we're going to start into a conditioning where we're going to go up a little bit more. And I think those are things that break down sometimes in the communication. We are really working through this in the industry right now, right? And I think you'll see over the next 3 to 5 years, we're going to get better at this and understanding the difference between it, right? Because straightforward conditioning on a healthy horse can be accelerated a lot faster, especially if your horse has a good, quick recovery rate, right? But at this point, let's make sure that we look into that slower gradient, especially with our older horses coming back and the rehab that we're doing. Thanks again, everybody. Have a great day.